I'm Dr. Bryan Smitherman with the Center for Orthopedic Surgery. I want to thank you for taking time to review this video. By making this, my hope is that it will safely ensure that your procedure and the postoperative rehab which follows guide you safely to a successful joint replacement procedure. With this video, we will instruct you not only what will occur preoperatively, but also postoperatively and after your hospital discharge. In the week prior to the scheduled procedure, we will schedule you an office visit with our office, at which time you will meet with either myself or my physician's assistant. We will review your medical issues, your medications, and give you orders to take to the hospital to pre-register for your procedure. At that time, you will also be scheduled your postoperative follow-up appointment in our office, which is typically 10 to 14 days after the procedure. In most cases, you will be scheduled to see an internal medicine physician who will go over your chronic medications, your chronic medical issues, and review them to ensure that you are safe to undergo the procedure and will be prepared to follow you during the hospital stay and after your procedure. Our goal is to help your medical conditions remain safe during the perioperative period. At that office visit, you will be given a packet with documents including your history and physical examination, the orders for admission to the hospital, and your postoperative appointment. Once you arrive at the hospital, that packet will be taken, lab work will be drawn, chest x-ray, EKG, and other labs as deemed necessary for your medical conditions, and also your appointment with your internal medicine doctor will typically be on that same day. The night before the procedure, you will typically receive a call from our office explaining what time you need to arrive at the hospital. It is important to be prompt on your arrival to the hospital to facilitate you checking in, the appropriate forms being filled out, and you being prepared for surgery. The night before the procedure, we request that you shower and thoroughly cleanse the area to be operated on with antibacterial soap. We also recommend that you shower again the morning of the procedure, once again with antibacterial soap. By showering with the antibacterial soap, you will decrease the colony counts of bacteria on your skin and lower your risk of infection. As with any surgical procedure, there are risks that go with the procedure. With joint replacement specifically, risks include pain, and that includes both surgical pain and pain during the post-operative rehab time. There's also a risk of infection. Infection can be increased risk with the conditions such as rheumatoid arthritis, diabetes, particularly diabetes that is not well controlled, previous infection in the joint, cancer, treatments for cancer, or other disorders which may lower your immune system. Other areas of infection in your body, or even bad teeth, can increase your risk of infection. If you have bad teeth, it is recommended that you see the dentist to have these corrected at least 6 weeks prior to your procedure in order to lower your risk of infection. There's also a risk of fat escaping from the bone and going to the lungs during the procedure. There's a risk of shortening, deformity, or limp following the procedure. There's also a risk of blood clots. To prevent blood clots, we recommend early mobility, movement of the leg, which also includes a flexion of the knee, wiggling of the toes, and flexion of the ankle. This moves the blood in the extremity and lowers your risk of getting a blood clot. We will also, in most cases, either give you a new prescription for a blood thinner or continue your preoperative blood thinners to lower your risk of getting a blood clot. There is also risk of continued discomfort in the joint even after the procedure is completed. There is risk of needing further surgery should stiffness occur or should you develop infection in the prosthesis. Should infection occur in the prosthesis, it is possible that removal of the prosthesis, placement of an antibiotic spacer, and subsequent later revision to implant a new knee prosthesis could be incurred. Also, in very rare circumstances, amputation of the limb may become necessary should infection be difficult to control. One thing that has recently changed with the healthcare overhaul is that many of your insurance policies will limit both the access to rehab stay in a facility after surgery or limit the facilities that are available to be paid for by your insurance company. We strongly recommend that you contact your insurance carrier to find out what benefits your specific policy may entail so that we may better facilitate the appropriate rehab for you after the procedure is completed. On the day of surgery, when you arrive to the hospital, you will present to the admitting office. We encourage you to bring with you any directives to physicians that you have so that they may be included in your medical record. Once you have signed appropriate forms for admission, you'll be taken to the perioperative area. You will change into your surgical gown, an IV will be begun, and preoperative antibiotics will be started. Once these are completed, a permission form for the procedure will be signed, and also you will have time to visit with your surgeon as well as the anesthesiologist who is performing the anesthesia. In most cases, a block called a femoral nerve block will be administered, which helps control pain in the postoperative period. This numbs the front of the leg down to just below the knee and helps with the pain, but also can sometimes weaken the leg, causing it to feel heavy and sometimes feel as if it will buckle. The therapist will help you with how to manage this situation following your surgery. Okay, good morning.
Good morning.
Are you ready to work on this knee?
Yes.
Okay. Well, when we get back in the operating room, it'll take us about an hour to do the procedure, probably about 30 minutes for anesthesia to get you to sleep, get your legs sterilized and everything ready to do the procedure. So we'll be back in the operating room about an hour and a half.
Okay.
The anesthesiologist will do a block in your groin, which will numb the front of the leg down to about here, called a femoral nerve block. Should take a great deal of the pain away at the time of the surgery, and it lasts until 2 days after the surgery.
That's good.
The therapist will work with you on how to get up and down with that because it will feel a little bit weak, like your leg may want to buckle. But the pain control you get with it at first is really worth it.
That's good.
After the surgery, you'll be in recovery room for probably about 45 minutes. We'll get the bending machine called a CPM, continuous passive motion, that gently bends the knee back and forth. Fit that to you in recovery. And then you'll use that 6 to 8 hours a day minimum and for the next 3 weeks.
Oh, okay.
We'll get you up tomorrow morning to start doing some walking. But later today, if you want to sit up on the bedside, you can do that. We won't get you up to walk, though, until tomorrow. You can have clear liquids when you first get to the room, and then if you tolerate those okay, you can go on to solid food later in the day as well.
Okay.
We'll start you on some medications for blood thinning tomorrow to prevent you from getting a blood clot. But the more you work your toes and wiggle your legs and your ankles, the less chance you have of getting a blood clot.
Okay.
Are you ready to get started?
Yes.
Okay, I'm going to mark your legs so that everyone knows where we're going for surgery,
That's a
okay?
good plan.
All right. After the surgery is completed, which typically takes about an hour, you'll go to recovery room for 45 minutes to an hour before you're taken to the orthopedic ward. Once you arrive to the ward, you may begin clear liquids and advance your diet as tolerated, provided you are not nauseated.
Put one hand on the walker, one hand on the bed, and you have to use your right knee to stand up. Put more weight on your hands until you see if your leg's going to support you. And step with the right. Here you go. Walker, left, right. Now if it buckles or it hurts, you can put a little more weight on your walker, okay?
Okay.
You will be started in a machine called a continuous passive motion, or CPM machine, in the recovery room or shortly after returning to your room on the orthopedic floor. We recommend use of this machine for 6 to 8 hours a day for 21 days following the surgery to help prevent stiffness in the leg. When you are not in the bending machine, you may reposition as tolerated within the bed. The morning after surgery, physical therapy will arrive. We'll teach you bed mobility exercises, how to get up safely, and how to ambulate. In most cases, you'll be allowed to fully weight bear on the operative extremity on the first day after surgery. They will teach you how to adjust the positioning of the CPM machine and how to adjust the degree of flexion. In most cases, you will follow up in our office 10 to 14 days following the procedure, at which time the staples will be removed from the skin, an x-ray will be obtained to review the positioning of the implant to ensure that no changes have occurred, and to transition you from the home therapy or your facility to an outpatient physical therapy facility to continue your rehab. In most cases, at this 2-week follow-up, you may begin to drive, provided you are ambulatory with a cane, and we will progress your physical therapy and your activities as tolerated for approximately 6 to 8 weeks after the surgery, at which time we will recheck you here in the office and be able to check the progress you've made with physical therapy and see if you've completed your postoperative therapy. I thank you for taking time to review this video. I hope that it has been helpful to instruct you on what to expect during the perioperative period, preoperatively, during your hospital stay, and in the postoperative period that follows. Our goal is to guide you safely through the procedure and the postoperative rehab to the best result that you can have. Once again, thank you.